Welcome back to the Deep Dive. Today we're taking a really specific look at something super important.
Mm.
If you, or maybe someone you know has gone through it, navigating recovery after an arteriogram or an angioplasty.
Right. Pretty common procedures, actually.
And to guide us, we've got this detailed post-procedure protocol directly from a vascular surgeon.
That's right. And these procedures, well, they involve doctors accessing your blood vessels,
Mm.
often through just a small puncture, usually, in the groin area.
Okay.
So the recovery isn't just about, like, general rest. It needs very precise care.
To make sure that spot heals okay.
Exactly. Heal securely, prevent complications. That's the goal.
So our mission today is really to unpack the instructions from this protocol. We want to focus on the rules that might seem, well, kind of surprisingly strict.
Yeah, some can seem intense at first glance.
But they're absolutely crucial, right? Especially those first few days, maybe weeks.
Yeah.
And why does this matter? Well, obviously, if you're facing this, you need to know this stuff. But even if not, honestly, it's a fascinating peek into just how detailed modern medical care, especially vascular care, can be.
It really is. That immediate period right after the procedure, it's absolutely critical for things to heal properly.
Okay, so where does the protocol start? What's the first big thing?
Well, the first thing it really hammers home is maybe the most surprising one. It's all about your position, how you hold your body.
Okay, let's dig into that. It says, like, really clearly, do not sit.
Mm-hmm.
For the first, 24 to 48 hours, you're basically meant to be lying flat.
Essentially, yes. Flat or very close to it.
But wait, here's where it gets super specific almost. Intense. If you have to sit up.
Like, absolutely must.
Right. The instruction is maximum 45-degree angle, sort of a slouch,
Exactly. A slouch is a good way to put it.
and only for 5 minutes at a time.
And only every 6 hours.
Wow. That level of restriction,
Mm-hmm.
it feels like a lot.
It really is, but it tells you just how fragile that access point in the artery is right afterwards.
So bending your hip more than that.
Puts direct pressure right on the wound site. And that significantly bumps up the risk of bleeding or getting a hematoma.
Hematoma.
Yeah.
That's like blood collecting outside the vessel.
Precisely. And a bad hematoma, well, sometimes that needs another procedure to fix it. So this simple do not SE rule, it's really fundamental. It's about protecting that repair job.
Okay, that makes sense now. Prevent bigger problems down the line.
Right. And it also means, no driving. And even if you're a
Get
passenger,
that leg straight.
as straight as possible, yeah. That's key in the car, too.
Got it. So that intense initial period,
Yeah.
once you're past those first hours of lying flat, what else is important physically,
Well, you still need to take it easy for a bit, no strenuous stuff.
right?
And the protocol also suggests elevating your legs, like propping them up above heart level when you're lying down.
Oh, okay. Why is that?
Gravity, basically. It helps reduce any swelling, especially near where they went in.
Makes sense. Okay, what about taking care of the actual little wound? How specific does it get there?
Oh, very specific. It says you should take off the hospital dressings while you're showering.
Wait, in the shower? Doesn't that get it wet? I thought you had to keep wounds dry.
It does sound a bit weird at first, yeah. But the idea is a quick shower, less than 5 minutes, and then, importantly, after you gently clean the puncture area.
With what? Just soap and water?
Usually they recommend specific things like Prontosan or sterile saline. They're special antiseptic cleaners, gentle but effective for wounds like this.
Ah, yeah.
Then you immediately and very carefully pat the area dry and put fresh dressings on.
Okay, speed and the right cleaner. Got it. What about medications? That's usually a big part of recovery.
Absolutely critical. The protocol really stresses sticking to your prescribed meds schedule, no messing around with it.
Like the ones you were already taking.
Yes, continue your regular meds for things like high blood pressure, diabetes, whatever you have, and then you'll almost always be put on an antiplatelet drug.
Like aspirin.
Often aspirin combined with something else like clopidogrel, yeah. And if you were already on a blood thinner, an anticoagulant like warfarin or maybe rivaroxaban.
And keep taking that too.
Usually, yes. These meds are vital.
Mm-hmm.
Working inside blood vessels, well, it can slightly increase the risk of clots forming. So these drugs help keep your blood flowing smoothly, prevent blockages.
Okay, so you're lying flat, taking meds, cleaning carefully.
Mm-hmm.
But what if something feels wrong? What should you actually be watching out for?
Good question. The protocol is very clear on warning signs.
Like what?
Any sudden pain, new swelling, losing sensation, weakness, if the leg changes color, or any bleeding from the site that just won't stop easily.
Anything sudden and worrying, basically.
Exactly. Any of those things or other changes that concern you, you need to contact the consulting rooms immediately.
Don't wait and see.
Definitely not. These could be signs of a complication that needs checking out fast. And speaking of contact, you also need to arrange your follow-up appointment, usually within about 2 weeks. The onus is on you, the patient, to call and book that time.
Right. And that brings us to maybe the biggest takeaway message from the whole thing. It's written right here. When in doubt, phone the consulting rooms.
Absolutely. That's the golden rule. They'd much rather hear about a small worry than have you sit on a potentially serious problem.
Better safe than sorry, for sure.
And, while that immediate recovery is intense with all the rules, the protocol does look further ahead, too.
Towards longer-term health.
Yeah. It emphasizes getting into daily exercise eventually. Things like walking, cycling, swimming. They're great for strengthening calf muscles and boosting overall circulation.
When can you usually start that?
You can typically get back to a full exercise routine after maybe 4 weeks or so, but it depends on how your recovery goes.
And it also mentions the big lifestyle things, right?
Yeah.
Like weight and smoking.
Absolutely. Controlling weight and definitely quitting smoking are highlighted as critical long-term goals for keeping your blood vessels healthy.
It even mentions getting help to quit smoking, like specific medications if needed.
Yeah, things like varenicline or bupropion are mentioned as options if someone's struggling to quit on their own.
Okay, so wrapping this up, we've talked about that really strict initial phase, then being super vigilant for any warning signs.
Right, and then that shift towards long-term habits for vascular health.
And underlying it all is that key principle, if you're unsure about anything.
Call the consulting rooms. Don't hesitate.
So here's a final thought to maybe chew on. Think about how getting through those really specific short-term rules, like that tough don't sit upright restriction.
Yeah, the discipline that takes.
Right. How might successfully navigating that immediate challenge actually build the kind of discipline and maybe momentum you need to stick with the really important long-term goals, like exercising every day or managing your weight, to keep your vascular system healthy for years to come?
That's an interesting connection. Short-term adherence potentially fueling long-term commitment? Something to think about.